Jingle. Every year on 14 June, countries around the world celebrate World Blood Donor Day. It was established in 2004 to raise awareness of the need for safe blood and blood products and to thank blood donors for their voluntary life-saving gifts of blood. This World Blood Donor Day, we are highly privileged to have with us Dr. Rejikumar, our Medical Officer, Homeo Dispensary, Kurman, Pathanamthitta, National Quality Assessor for NADH, former State Program Manager, National Ayush Mission, BHMS, MD. Sir has humbly agreed to have a question and answer session with us cadets.
The very first question that comes to our mind when we hear about blood donation is, why should we donate blood?
Yes, your question is very valid. Actually, why should we donate blood when the question is asked? Blood donation is the most important social service that any person can do because blood is needed by any person at any point of time due to many emergencies as well as many diseases. Blood is needed by pregnant women during their complications if there is any, especially during severe anemia, and also in children with severe anemia, and also people suffering from malaria, malnutrition, and even for accident victims as well as surgical and cancer patients. So there will be a constant need for regular supply of blood, and blood can of course be stored for a limited period of time only before use. So regular blood donation actually helps saving lives, and that's why we are celebrating World Blood Donation Day on June 14th, and lot of social initiatives are going on behind this.
Sir, can you briefly tell us about the criteria to donate blood and who are all eligible to donate it?
Well, the criteria for selection of the donor for blood donation varies from country to country, and most countries actually prefer persons who are aged between somewhere around 17 to 65 who can very well donate blood. And of course, persons should be reasonably healthy, and the person will be able to give blood regularly, at least twice a year. That's every 6 months they can donate blood. So, unless persons they are suffering from any severe disease that will actually prevent them from giving voluntary or blood donation for transfusion, definitely all such persons can give blood. Yes, I should also add to this question asked by you that who should not actually give blood. Any person who is suffering from any infectious disease that can be transmitted to blood should not try for blood donation. And if the person is not feeling well, the person is having severe anemia, person is pregnant, and person is under certain medical conditions which makes his condition unstable, and if there are several medications going on, especially antibiotics, then ideally it's not the time to go for a blood donation.
Blood donation is relatively a safe way to help people with serious medical conditions. We have heard that donating blood can lead us to some side effects. Is it true? If so, can you briefly touch upon the preparations that needs to be done and the things to be avoided before donating blood?
Yes, many of us are often dragged into blood donation out of necessity. We do it without any preparation and we go for blood donation. But in a prepared settings, we have to take some precaution. If you are preparing for a blood donation, today or tomorrow, then we have to avoid certain things and we have to abide by certain situations. That is, we have to avoid taking certain foods that will be actually adversely affecting blood donation, and we have to take some food which can actually help increase your blood production, like food rich in iron. For example, foods like food substances, vegetables like amla or the gooseberry, and vegetables like which can improve the fruits, dry fruits like dates, which can actually increase your iron content. These are things that can easily be taken. Fish, tuna, shrimp, clams, and like things like that. Eggs. These things can actually help your iron content in your blood and also increase blood production. Vegetables like spinach, sweet potato, peas, broccoli, all these things can be considered. Fruits that I have mentioned, like dried peaches and dried apricots, in addition to dates, all these things will actually help, and also beans. So, food rich in iron and generally vitamin C, like papaya, kiwi fruit, pineapple, berries, different types of berries, all these things, citrus fruits can actually help increase your production of iron, and also production of blood, in fact, with the help of iron supply from these items. And also drink plenty of water, at least extra cup of water, say 2 to 3 cups of water before going for blood donation will actually help. Ideally, you should take somewhere around 10 to 12 cups per day, especially before the day of blood transfusion. This will actually help. And what are things to be avoided? Of course, you have to avoid alcohol, fatty foods, substances which can block iron, like excess coffee, red wine, chocolate, all these things. It's better to avoid before the blood donation. And of course, you should avoid taking any analgesics, especially aspirin containing medicines. So these are the things that I think you should keep in mind.
Sir, could you explain us in brief the procedures when we donate blood?
Well, the process of blood donation actually differs from institution to institution, but there is a general criteria. In a controlled setups, that is in blood banks, there is a normal procedure wherein you will be walking in voluntarily to the blood bank at any time of your convenience. And if it is in outdoor camps, again, it will be conducted by different welfare organizations, or even our National Blood Transfusion Council under different units they will be doing. So you can walk in, and first process will be a simple process taking, say, just less than 10 minutes. It will be a registration process wherein they will record your details. They will take your consent for your donation, means blood donation, and that will be followed by a very minimal medical checkup, not lasting beyond 5 minutes. They will ask you for your medical history, if there is any history of allergy or any history of intake of drugs, that they will ask. And also they will make the baseline assessment, including your temperature, blood pressure, your pulse rate, and your hemoglobin levels as far as possible. And that will be followed by the actual process of donation, wherein they will be drawing around 350 to 450 ml of blood from your body. And you have to understand that there is no side effect in giving your blood, because this is not something like water is poured from a jug and the jug becomes empty, because blood is produced day by day, and actually minute by minute blood production is going on. The process is known as erythropoiesis, wherein especially the RBCs, red blood cells, are being produced. So the whole process takes 10 minutes, and your blood donation will be completed, say, around 8 to 10 minutes. And that will be followed by a mild refreshment, wherein some snacks or drinks will be given to supplement the uneasiness, simple weakness that may often find. Usually the process is uneventful and there won't be any complications, and in 99% cases the persons can resume their normal activities or any activities that they were doing just after, say, around 5 to 10 minutes of taking this refreshment and some sort of rest. So that's all about the whole process of blood donation. Thank you.
A few minutes of your time could mean a lifetime to someone in need. Be a real superhero, because every time you donate a blood, you becomes a real superhero to save someone's life. We thank all the blood donors who are out there and expect more to donate their blood as much as possible. Donate blood, save lives.